like a concussion. So then we move up 1,000 years. So the pre-Incan civilizations, the trepanation, using surgical tools. So somebody, which was very nice, brought in a skull with a trepanation hole in it, which is amazing. So that's how big it is. So actually it's pretty close to that. So, and there was, this is apparently the tool. So we were trying to figure out what the tool, actually how you get in there, but I guess you can scrape away the skull, you can probably pick at it, and you can essentially make a hole. So as it says that, it may be used for both spiritual, magical reasons, but treating headaches, epilepsy, mental illness. So it was basically the cure-all, so I'm just going to bring up epilepsy. But again, what's instructive about this, that's a pretty big hole. What's instructive about this is that this is still what happens today. So if you have a hemorrhage, if you have a stroke, a hemorrhagic stroke, there's a lot of pressure that will build up in that particular part of the brain. And I mean, they don't make a hole this big probably, but what they'll do is they'll puncture the skull to relieve the pressure, to let the fluids become, to discharge. I'm gonna put that right up there. And I mean, I'm sure that the rate of infections were pretty high in those days, and they're less so nowadays. But again, the treatments are essentially the same, that we're still making holes in the skull to relieve pressure and to treat, some sort of neurological impairment, so like a stroke. So now we get into the Middle Ages. So the brain studies ceased due to a church ban on dissection and study of anatomy, but there are still people who are roaming, like this person, roaming the countryside and doing these, it's enterprising barbers. And I think this is also really interesting, tidbit of history that repeated itself. But these people, so they're removing the stone of madness from the skulls of the mentally ill. So essentially, they're going in there with their knives, cutting open a hole, probably doing a bit of a trepanation. Who knows what they were doing, maybe letting some bleeding out. But it was meant to treat these illnesses. So at least, again, I give them credit for realizing that it was the brain that was actually causing these mental illnesses, which again was not a real popular idea back in those days. Most people thought it was the heart that controlled everything we did. So now we move up quick, hundreds of years from the remote to the recent past, so the 1900s. And I think this is where now we actually start making some progress, and some really, really fascinating progress. Starting with phrenology. Actually, I used to have a skull with a phrenology on it. But anyway, so this was kind of one of the first studies to start to look at localization of function in the brain. So again, you'll see where this is going because it does actually lead up to some treatments for surgeries. But essentially what the phrenologists were doing was looking at the heads, just the skulls of groups of individuals who they believed represent the extremes of society. So criminals on one side, clergymen on the other, and they said if we can look at their skulls and make some, distinctions about where the bumps are on their heads, we can figure out what parts of the brain are responsible for those underlying functions. So this isn't really a good picture. This is a bit better. So what I think is interesting though is that, so the phrenologists mapped out what they thought. They were mapping out the brain based on the shape of the skull. So if you have a big bump in, let's say, right here behind the ear, that was where destructiveness came out. And if you had a big bump back here, that was because you were combative. And if you had a bump here, it was because you were love. And all these different personality traits based on where presumably there was a bulge on the skull, and with that there would be a bulge in the brain. That part of the brain would be larger, push out the skull, and that's what created this personality trait. Completely wrong, but what I think is interesting is that it did start, again, give them credit for saying that the brain had this specialization of function and different parts did contribute to different functions, which is totally true, just not in that way. So they kind of missed the boat. But there is this specialization of function, and this, again, was not lost on Penfield when he went in and said, now, if a person is having this, this aura prior to their epilepsy, prior to their surgery, what is that aura? So if somebody hears a sound, he could say, well, I know where the auditory part of the brain is. I'll go in there with my little electrode, I'll start poking around, and I'll say, what do you hear now? What do you hear now? What do you hear now? And then when the person says, I hear the, the chicken clucking, that's it. So that's where the seizure originates, so take out that part of the brain. So the specialization of function, based on the phrenologist, was actually a good setup point for how Penfield was actually treating epilepsy, and how we understand how the brain actually functions today. So there he is. So Wilder Penfield at the Montreal Neurological Institute in Montreal. So what he was doing was getting patients coming in who have epilepsy or had seizures, and he would say, what we're going to do is we're going to figure out what part of the brain where the focus is, where the focal part is that's causing this electrical discharge. So he in fact had these patients awake in an operating theater. There were local anesthetics, and it was all sterile, and he was very peculiar, or he was very particular about how he did this, and very methodical, because he started mapping out everything that he did. So he stimulated the brain in these awake patients during surgery for epilepsy, and essentially it was to make sure that he didn't wipe out something that was really important, like he didn't just damage the person's ability to talk or to hear, to touch, or to feel, or any other these basic functions. And of course, so they had to be awake so that they could report on what was happening. So I think this is the video that really kind of explains that better than I can, because they're the professionals. So these heritage minutes. So I'll let this go. I'm going to mute me.
So, toast is burning.
Toast is not. Every time she has a seizure, she smells something burning. Now, if we can provoke that smell by probing the surface of the brain, we'll find the source of the seizures. Mrs. Gold, do you feel anything?
You can see the most wonderful lights.
And now what do you feel?
Did you pour cold water on my hand, Dr. Penfield?
Now what?
Oh,
What is it, Mrs. Gold?
burnt toast. Dr. Penfield, I can smell burnt toast. Dr. Wilder Penfield. He cured my seizures and hundreds more. They say he drew the roadmap of the human brain. We just called him the greatest Canadian alive.
Okay. Sorry. Wow. That'll set off the seizure. Goodness. Yeah, we'll let ourselves recover quick. Okay. Okay. Whew. Guess I have to check the audio output on that one. So anyway, so that sort of describes it in a nutshell, where that woman smelled burnt toast. The husband said there's nothing burning, there's no burnt toast, and then she had her seizure. So she had her aura, and then she went into the motor patterns of a seizure. So Penfield's idea was that we stimulate that part of the brain, we find out where that aura is, and that can be the focus. That'll be the focus of where the electrical discharge starts. Remove that and cure them from their surgery. So I think again, another fascinating part of history is in 1953. So this patient HM, same problem. He had intractable epilepsy. So they were giving him medication. Nothing was happening. Nothing was helping. So he went in to visit actually William Scoville, so one of the colleagues of Penfield. So had the same idea that they could take out parts of the brain to relieve epilepsy. And so in this case, patient HM had these temporal lobe seizures. So the most common type of seizure started in this part of the brain. It doesn't matter which those specifics are, but down here in the temporal lobe. So the hippocampus, really important for memory. The amygdala, important for the anxiety and the fear responses, and then all these other cortical areas. So essentially, what Scoville did was removed all this tissue from patient HM. So pretty good chunk of what's classified as the medial temporal lobe. But you can see what that contains is that amygdala, that fear center, and the hippocampus, which we now know is really important for the formation of memory. So patient HM woke up, he was fine, sort of. He couldn't recall anything that happened after the surgery. he could never form a memory ever again. In fact, he had what's called retrograde amnesia, so severe amnesia, both retrograde, so he couldn't remember things for about the past 15 years before the surgery, and then everything after the surgery, he could never form another memory again. So it was a bit of a deficit, but he had an average IQ. In fact, he was quite normal on tests that he could do, so if you sat him down, give him an IQ test, he did it fine. You could give him the same test the next day, he would never remember that he took that test, but he'd do fine, same thing, so day after day after day. And he could do other tasks that could show that he could still learn. So it wasn't a general learning deficit, it was a really particular memory deficit. His epilepsy was eliminated, so seizure activity was cured, but again, what happened is, so this woman from Montreal, Dr. Brenda Milner, was integral in testing this patient throughout, for in fact most of her career. So she started with Penfield in the 50s, she's still alive today, really fascinating lady. She tested HM and discovered that he could never form a new memory, and every day that she went in to test him, he always said, "Hi, my name is Henry," and she'd say, "Hi, I'm Dr. Milner, we met yesterday," and he had no clue that he had ever met her. So it was a fascinating, example of how surgeries were performed to control, epilepsy, and presumably what, the idea was to not affect other functions, but in fact what happened with HM is memory was eliminated, and now it led to these really, fascinating studies about how memories are formed in the brain. Yep.
If he had an average IQ, how could he not remember what happened yesterday? I mean, I don't see the...
Well, I mean, I guess so. If you look at what an IQ test is, it's not really based on memory. It's based on how well you function in the current, right? So you can sit here and take a test, and tomorrow, like he was probably about 25, I think, when he had the surgery. So the 10 years prior to age 25, he couldn't remember things that happened in his life. But there was still a period of time, from when he was 0 to 15, let's say, that he had perfect memory of those events. So he still had intelligence. He still had gained a lot of intelligence through his life. But then, he just couldn't remember what he had for breakfast, and that's not really a measure of IQ necessarily. Okay, so another interesting case example, and I think any course on the brain has to talk about this, and I figured that this was a really good day to get this in on just these, the history of brain surgery. So Phineas Gage in 1848 was this case study. So essentially, I'll let you put this up and then I'll just talk about it. But he was a railroad worker in Vermont, and he was putting in a spike or something, and apparently the dynamite exploded and the tamping rod went through his cheek, behind his eye, and through the top of his head. So it just went straight through like I guess like a rocket. So he fell back in a convulsive heap, so he probably, again, had a surgery. I mean, that's a pretty traumatic brain injury. But within moments later, he stood up and actually spoke. So he could walk, speak, demonstrate normal awareness of his surroundings. So in fact, he fared pretty well. And this is one of these cases where, everybody in the history of brain research was lucky that he was, did that well. So essentially, this is what his brain, the damage to his brain looked like. So if you look at just the front of his brain, again, this is through the frontal cortex, you can see that this entire, I guess it's his left side, was completely wiped out. There was all that damage from that tamping rod. So what happened is, so again, he seemed normal, but then what people started noticing is that he had this dramatic shift in his personality. So his disposition to such a degree that his friends barely recognized him. So they didn't think it was the same person that they were talking to. So, before this accident, he was like a clergyman. After, he was like a criminal. So he started swearing, smoking, drinking, just really, his personality did a total 180. So again, once a polite and caring person, like a clergyman, Gage became prone to selfish behavior, bursts of profanity. He had a radical personality change. No respect for social graces, often lied about his accomplishments. So again, it's really instructive, something that I've been talking about throughout this course. This actually should have been the last lecture now that I think about it. But anyway, so about how the frontal lobe is really important for all these really, personality functions, social graces. Basically that part of the brain dictates how we behave in society. And he lost his. So, and this, again, it was one of these case studies that led up to a whole realm of understanding about how the frontal lobes are really important for our human functions. So then we take a dark step through the surgical treatment of mental diseases. So the lobotomies in the 1900s, made probably most famous by Walter Freeman, although he did not discover the technique. It was a Portuguese guy. But Freeman in the States, took off with it. He was sort of like the fast food industry of lobotomies. So the transorbital lobotomy. So it's, if you have a weak stomach, you might want to just not read this. But so essentially what's happening is he was putting, what most people would say is an ice pick. So, not much different probably than this that the Incans were using. But he was a bit, he had a bit more scientific rationale for this. So he would put an ice pick to the top layer of the skin above the eye, put it into the frontal lobes and just wiggle it around a bit and keep wiggling it until the patient was cured. So it required only a few minutes to performed in a doctor's office rather than an operating room. In fact, I've heard stories where he had patient, he would be lecturing like this, have a person come in, they'd put him on a table, and he'd do it right in front of a class. So it was, like I said, it was the fast food of brain surgery. So he performed the operations on thousands of people, nearly 20,000 documented lobotomies were performed. So like I said, he was going around and people thought that this was the way to cure mental illnesses, behavioral disturbances, I guess. So again, this is where the next one will be a bit more, not totally gruesome, but a bit maybe heart-wrenching. So the traditional method was, and this was what, I think his name was Munez in Portugal, he would go through the sides. So he would drill holes actually in the side of the skull, put his scalpel through, and then just sever all the connections between the frontal lobe and the rest of the brain. So then what Freeman was doing was this technique. So the new and improved, he could do this in a few minutes, is he'd put his instrument through the top of the eye and then go back into the frontal lobes and essentially destroy that part of the brain. So this was just one of the, again, one of the testimonials that this guy was talking about his mother. So before, she was absolutely violently suicidal beforehand. After the lobotomy, there was nothing that stopped immediately. It was just peace. I don't know how to explain it to you. It was like turning a coin over that quick. So whatever he did something right. So people were, sold on this technique because it was, people that really had probably these suicidal tendencies or maybe depression or whatever it was, this lobotomy was curing them. But again, what they were using it for now was to almost control behavior. So anybody who was a bit of a anarchist, let's say, or somebody who wasn't conforming to society was going under the ice pick and getting a lobotomy. So again, now if we just remember this that I put up here before about during the Middle Ages, during the Dark Ages, you had these enterprising barbers roam the countryside offering to remove the stone of madness. So I think no disrespect, but I think that's pretty much what Freeman was doing, is he was roaming the countryside, roaming the states and saying, I can cure people of their mental illness, their pierre de folie, and all we have to do is stick an ice pick through the front of their brain and chew it up and they're cured. So it's, again, it worked, but there's, people now are finding that it did cause some pretty long-lasting deficits.
Do you happen to know, was he the surgeon that performed the lobotomy on the Kennedy doll?
I don't know. Probably, yeah, probably, I would bet. Because he would, again, he was the most famous, person for this, yeah. So likely he was. Okay, so pharmaceuticals, where we are. So I'll try to get rolling through this. So again, now thinking about what epilepsy is, it's overexcitation of electrical activity in the brain. So you have these two processes, excitation, inhibition, and they have to balance each other out. So if you have too much excitation, then that's often what will lead to seizure activity. So what you want to do, and I think I'm just going to jump over these, that was before. So what you want to do is to decrease that excitation. So typically the drugs, the most used, not necessarily the most promising drugs, are ones that will increase the inhibition of the brain. So again, it's this massive electrical discharge that's often brought about, maybe I should put up these just once. It's this electrical discharge that's brought about by these these proteins in the brain and neurons that are allowing these positively charged ions to flow in and cause this electrical disturbance. So what you can do is you can block these that allow for excitation, so you can stop the excitatory parts of the brain from becoming active, which some people do, but again, this is how our brain normally functions. This is what we need to do to learn to remember, so you don't want to do this too much, because if you start stopping that excitation, you might affect a whole host of other processes. So again, what the idea is here is you increase the inhibition. So if you remember this from the alcohol lecture, what you can do is actually activate these proteins that will allow these negatively charged particles into the cell, and that will stop it from being overactive. And so again, you think about benzodiazepines, they work quite well, Valium works quite well, alcohol works, all those different types of drugs will work to increase inhibition in the brain, relatively safe without too many side effects. So that's where people have gone in the treatment of epilepsy, is to give these drugs that will increase the inhibitory properties of the brain. So in fact, this valproate is essentially, that's the active ingredient in this drug that really works to help epilepsy and decrease the seizure activity by increasing inhibition. But again, I'll put this up, but I don't want to meander too much on this. So again, with most drugs, we have a relatively decent understanding of how they work, but not exactly. So it's not fully understood the way in which this valproate actually works. It has a number of targets. It's clearly very effective in stopping seizure activity because it does increase the inhibitory properties of the brain. It blocks this increased neuronal firing. It probably increases the action of a lot of these inhibitory neurotransmitters. It does, everything that we'd hope it would do, but again, it's not really understood what the long-term effects of this are. So the person has to take this drug, essentially, for the rest of their lives. So this is also, I think, a really good video, and there's no sound in this. I won't have to, but I'll talk through it. So again, I always like this, and I show it to my class because I think it's an interesting way to actually show what a seizure looks like, at the minuscule or at the micro level of the brain. So essentially you have the axon, the output of one brain cell, of one neuron, coming here with all its neurotransmitters here, and those chemicals jump across that little space, bind to the proteins here, and allow, so in this case it's an excitatory process, so those channels will open and allow those positive ions to come in, and that causes this cell to fire its action potential. So it's an electrical, chemical, electrical process. So I'll just roll this. So what they're showing first is essentially normal activity. So again, here's that calcium coming in, so how important calcium is to actually cause those chemicals to be released, to jump across that space, to bind to their receptive units, and then to cause that electrical activity to go. So this is that excitatory neurotransmitter. So now what they're going to show is the overactive electrical pattern that can happen when you have, let's say, a seizure of some type. So these little red things is the electrical activity. It causes this massive release of these these chemicals, which then causes the other side of the brain to become hyperactive. So what this is showing, and now again, let's not get caught up in the details, but there's all these signals in the brain so there's one that's floating backwards. It can actually turn this protein on to stop the calcium from being brought into the neuron, to stop the release of those neurotransmitters. So it's a way, so as I was talking about, most of the treatments for epilepsy are to increase the inhibitory properties of the brain. In this case, what they're showing is that, well, if you can turn on this part of the brain, or this little this protein, that can actually stop the excitatory processes of the brain. So you can see that it stopped all the release of that neurotransmitter, it stopped all the activity over on this side. The interesting thing about this is that's where THC works. That's where marijuana is purportedly to have its effect. So people are looking at this in terms of medicinal marijuana because this little receptor, there's all these endogenous chemicals that work here in our brain, but in epilepsy, what it's thought is that this chemical is decreased. So you can replace that with THC. It'll bind to that, and it will stop this over excitation. So this is kind of a newer treatment, and obviously it's got some baggage associated with it. Okay, where are we? Okay, so what I'll do is just get into the gene therapy a little bit. But actually, what I think I'll do is get into the stem cells, because I do want to cover that, because that'll have some important follow-up for the MS lecture. Yep.
Just a quick question. When anticonvulsants are used to treat depression, are they working in just the same way in the absence of...
Yeah, see, that's the thing about these drugs, is that they have a lot of off-label uses, so it suggests that they're working in ways that we don't quite understand. You know, so I think a lot of, I mean, that's the simple, quick answer, is that they do have a lot of activity in the brain, that there are things that they're doing that we just don't quite understand, but it seems to work, right? So I think I'm going to jump over the, like I said, I want to just get into stem cell therapy because it's about 11:25, so I want to try to wrap up here in 5 minutes so we can take a break. But essentially, so now this is why, again, why I wanted to talk about development earlier in this course, because what stem cell therapy is, that basically the theoretical aim is to bring a dysfunctional brain back to its embryonic state. So again, during embryosis, the brain has a lot of stem cells. It's producing all these neurons that are going to their places, forming connections, doing whatever they have to do. So in this case, what you want to do is to return that brain to that embryonic state so that you can regain function in those, deficient brain tissues. So, currently the main way to do it is, fetal cells, which again has a lot of ethical issues surrounding it. So what people are trying to understand is whether they can, get stem cells, let's say, from other areas of your own body. So one area is bone marrow, and then that may be a more effective source of stem cells, and also fewer ethical issues surrounding it. So the challenge, though, is so you can take these multi-potential stem cells, so a cell that can become any cell, any type of cell that you need in the body, you can take those into a dish and you can turn them into, let's say, a brain cell, no problem. But the big problem is getting it, once you get it into the brain, to let it do its own thing. So to make sure, first of all, it differentiates correctly into the proper neuron that you need, that's deficient, but also form the proper connections, reform those connections that have been lost through whatever disease state is in the brain. So that so essentially there's lots of different ways that people are trying to use stem cells. So form specific types of neurons or cells, so that's what I've already talked about, or they have those cells that produce the neuroprotective molecules or the molecules that are deficient in the brain. So in epilepsy, what you'd want is a stem cell that could go in and increase the loss of inhibition in some way, or remove the excitation. There's a couple different ways to do it. So that's essentially it. So again, I think this is really important when we